Diabetes symptoms. The various kinds of symptoms to deal with. Diabetes symptoms can be difficult to identify at first because the disease manifests gradually. Sometimes, because symptoms can also be common to other illnesses, the real illness may be overlooked. Diabetes symptoms vary, and the list is long, but not everyone, diabetes patients, has them. There are some cases where no symptoms appear in some patients. Diabetes develops when the body's ability to respond to insulin is impaired. Insulin is a hormone in your body that allows blood sugar, glucose, to enter body cells. When too much glucose enters the blood, it causes an increase in blood glucose, which can cause glucose spillage into the urine. This is the primary reason why the patient suffers from one of the most common diabetes symptoms, frequent urination. Because your glucose levels are higher than normal, your body cells are starved for energy, causing damage to your nerves, kidneys, eyes, blood vessels, and heart. When your body's sugar level drops too low, an increase in glucose levels occurs. It then increases sugar production. This process begins when the pancreas secretes the hormone glucagon. The glycogen that has been stored will be converted. How are diabetic symptoms identified? Diagnosis of diabetes patients varies depending on the duration and range of high blood sugar levels. Patients with type 2 diabetes are frequently diagnosed more slowly than people with type 1 diabetes, which may only take weeks or months. Symptoms may also appear gradually and mildly. Some of the most specific and common early diabetes symptoms are skin rashes and diseases, skin infections, inadequate skin healing, athlete's foot, sexual issue, excessive vaginal dryness, erectile dysfunction, to male patients, early menopause, to female patients. Menstrual periods are not present. Paresthesias, neuropathy of the periphery, infection of the urinary tract, distorted vision, illness, drowsiness, hand numbness, weight loss or weight gain. Other more severe diabetes symptoms include abnormal urination, abnormal thirst, dehydration, weight loss despite increased appetite, tiredness, fatigue, nausea, and vomiting, excessive hunger, increased bladder, skin, and vaginal infections, severe blurry vision, muscle aches, weakness, and cramping. Acne, increased sexual problems due to erectile dysfunction in men and vaginal dryness in women, menstrual period cessation. Other diabetes symptoms include bleeding gums, unusual noise or buzzing in the ear, numbness or tingling in the feet, skin itching, perplexity, depression. Diabetes complications include kidney disease, diabetic retinopathy, sciatica, cardiovascular disease and because the aforementioned symptoms may manifest at a later date for a patient, the checkup is usually scheduled at a later date. This is not a good idea because complications may arise over time, making treatment and management of the disease even more difficult. In this case, it is critical to see a doctor as soon as possible to avoid further damage to the body. Another thing to keep in mind is that diabetes is a lifelong disease that does not infect others upon C.